The state project began in 1947 as a facility to treat polio patients. It transitioned to a rehab hospital when polio was eradicated and there was no longer a need for a polio facility. Over the years, the hospital grew into a premier rehab system, including extensive physical rehab for all ages, hearing and balance, and wound care and hyperbaric medicine. Eventually, leadership saw the writing on the wall. It was financially impossible to operate a standalone rehabilitation facility like Idaho Elks Rehab Hospital in light of changes in the healthcare industry. In 2014, the decision was made to transition the operation of the rehab hospital to St. Luke's Health System, but the Elks continue to own the buildings, which bear the Idaho Elks Rehab name. The emphasis of the state project turned to a new focus, a philanthropic endeavor to fund community physical rehab. Over the years, the commitment of the Elks has remained steadfast to physical rehab and rehab patients in Idaho, helping each patient live life to the fullest. Idaho Elks Rehab's charitable mission of philanthropy supports the work of not-for-profit physical rehab providers, educators, and researchers throughout Idaho. The state project is truly advancing community rehab across Idaho. In 2022, Idaho Elks Rehab moved into a new headquarters directly across the street from the former Elks Rehab Hospital in Boise. The building showcases the state project and is a source of pride for Elks from across the state. Patient outcomes and community impact were at the forefront of funding from Idaho Elks Rehab, which may be used for equipment, staff training and education, program development, research, and local projects that enhance the lives of rehab patients in the state. Strong partnerships have been nurtured between Idaho Elks Rehab as the funder and rehab providers across Idaho.
Being a small nonprofit hospital can be very, very challenging to get the equipment we need to be able to provide state-of-the-art programs for our patients. The Idaho Elks came in and partnered with our foundation. We were just able to acquire an exoskeleton at the end of last year. So Jake has been a very special patient for us because he has been in our exoskeleton. What the equipment does is it actually will show you how much his body's working versus how much the exoskeleton has to do for him. They're able to set up a program for him to really help him progress in his gait and balance, mobility. And so to have it here, to be able to provide that to a patient, like even one patient, even two patients, the difference that it can make in someone's life is instrumental. And having the support of the Elks providing us with grants for equipment has allowed us to be able to expand our programs. They have helped provide equipment for an oncology gym.
Elks funding has provided a lot of the equipment that we use, from our Nautilus machine to our BioStep, which is a recumbent bike, and we have an upper body bike that's really important when we're treating our breast cancer patients. They have provided a high-low table, which allows us to adjust the height of the table and is wide enough that can fit two people so that we as therapists can get on the table with our patients, and that's been very helpful.
Oh, it's been absolutely life-changing. It's very powerful. I felt I got really individual care.
I try to minimize or eliminate their pain, restore their range of motion and their strength so that they can return to their lives. Elks funding has helped us so much in achieving this because they give us the equipment that we need to challenge our patients, to get them back on their feet and out in the community and living as a full person.
It's hard to make it. I mean, we're always just barely financially making it. We're a standalone hospital. We don't have a big corporate behind us. If you have something that is special that would help the patients, sometimes there just isn't the capital to do it. And that's where Elks can come in and really make a difference. So one of the first grants that you guys gave us was to help us develop our outdoor area. We do chip truck drivers, loggers, and they have to rehab. We have rocks out there, we have a ramp out there, we have a ladder to climb, we have a dually thing out there that we can throw the chains on. And the mission was to make it so people didn't have to go to Coeur d'Alene for physical therapy. By the time you drive an hour there, do your therapy, and drive home, you're back hurting just like you were before. What do we need to do to keep people not have to drive to Coeur d'Alene? Well, one of it is equipment, which the Elks have helped us with equipment for sure. And the other is having therapists that know what they're doing. So that comes into the training. So Elks has also helped us with training, some ASTEM training, lymphedema, wounds, and pelvic floor.
Vicky is one of my patients. Her wounds have been very difficult to heal, but we have started making some progress. She had a great wound care team up at Kootenai, but then coming back here, it was the option of, do you want to go up twice a week to Coeur d'Alene, or do you want to stay local?
Kendall is a physical therapy practitioner who's had extensive extra training in wound care.
We got a $10,000 grant for that. She became a lymphedema specialist and a wound certified specialist, and because wounds and lymphedema go hand in hand quite often.
Lymphedema is a type of a chronic swelling, a type of chronic edema associated with protein accumulation in the tissues. It's a lot more common than people think it is. It's actually massively underdiagnosed.
She's a wonderful practitioner, very knowledgeable.
Knowing that there was potential for me to go get a really high level of training the way that I was able to because of the Elks, it made a big difference for me career-wise.
This program has really added to her repertoire of all the things she can do for the community.
If a student wants to come to get health science education and stay within a state institution, we are the institution that they'll do it. By partnering with the Elks, we can continue to provide the most advanced technology to educate our students before they're going out into rural Idaho, which is an underserved community.
Elks funding has provided lots of opportunities for our students, and specifically the SABO VR program.
This is a system that we would use with a neuro population, so a population after they've had stroke or a traumatic brain injury or an anoxic brain injury.
It gives students exposure and access to equipment that they might come in contact with on their fieldwork settings.
We as therapists know repetition is the best way to continue to get improvement. This equipment is designed specifically that it takes you through a grocery shopping task, putting the groceries away within the home, and then preparing a light meal. So it takes you through those 3 scenarios 4 times throughout the process.
Those activities in the SABO VR allow them opportunities to practice skills that they might not be able to do as part of their education.
So the Elks provided a blood flow restriction training unit to us. Blood flow restriction training is it's an amazing innovation that really helps patients progress their strength. Students have the opportunity to learn the protocol and learn the physiology behind blood flow restriction training. Is a really unique experience, and they can go into the clinic prepared, understanding how it works, why it works, when they would use it, etc.
We appreciate all of the support and the quality of care that future therapists are providing is directly linked to the donations and the grants that we receive from the Elks.
Originally, when I came up here as just a physical therapist, we were in an 800 square foot room, just very small, used in the hospital to do both inpatient and outpatient rehab. We knew that we needed something bigger to kind of keep meeting the needs of our community. Really, since we've been in this facility where the Elks Club helped us, we're now into 4,500 square feet, which has just allowed us to grow as a clientele, as well as to open up not only our occupational therapy, but speech therapy as well.
Here in Preston, I work here, my home's here. So for me to be able to leave work, come here on my lunch hour, do physical therapy, or come early in the morning before work, it's convenient.
The patient knows they can stay home. They don't have to go somewhere big to get their PT or occupational therapy.
None of it would be possible without the Elks funding, absolutely not. This building wouldn't be here.
When we looked at the numbers, it was over $250,000 that they were able to donate to not only create this space, but also some of the equipment that we use in it. Honestly, when they came down and we had a ribbon ceremony, I couldn't express my gratitude enough. I just felt like This was a premier place for physical therapy, occupational therapy, and speech therapy.
You know, I was here the day that the building was open and the ribbon was cut. And back then, I didn't ever picture myself being a patient here, just visiting friends once in a while. But you know, now that I have been, it makes a world of difference in my life and so many others in our community.
The impact of our state project over the last decade is nothing short of phenomenal. The footprint of Idaho Elks Rehab funding continues to stretch further and further across the state, serving both large and small communities alike. From Bonners Ferry in the far north to Preston in the extreme south, and everywhere in between. Over the years, we have funded close to 30 local lodge grants at $1,000 each, and community rehab grants totaling nearly $500,000. In addition to these grants, we have also committed funds to several large projects, including the naming rights for the Idaho Elks Children's Pavilion in Boise, Valley Vista Rehabilitation Center in St. Mary's, and Franklin County Medical Center in Preston. Idaho Elks members, as well as the general public, can support Idaho Elks Rehab financially by investing in the state project in a number of ways, including general donations, memorials, Change for Rehab campaign, C-Notes, and bricks. Idaho Elks Rehab is having a significant impact on communities across the entire state of Idaho. We can be proud of the state project and its footprint throughout Idaho. Our commitment to physical rehab will never waver, with the desired outcome of each patient living their life to the fullest. For more information about Idaho Elks Rehab, visit idahoelksrehab.org.